Thank you, sir. First of all, a big thanks to Dr. Banshi and his vibrant planning of this virtual session. Fantastic. And kudos all of us, and thousands of viewers have been enjoying this conference right from yesterday. So big thank you to you and Dr. Shashank for such a successful event. DESG Symposium, as we are in. For all those who don't know, it's a section of EASD that aims to help at helping the medical professionals address patient education and analyzes their needs and addresses them in an effective manner. So with this, it's my pleasure and privilege to introduce the next speaker, Dr. Florion Toti from Albania, the president of the Albanian Diabetes Association, as you can see, also the lecturer at the Faculty of Medicine, Tirana Medical University, and the head of the teaching unit, Service of Endocrinology and Metabolic Diseases at the University Hospital Center, Mother Teresa. He also has a doctorate in medical sciences from Tirana University, has held several academic faculty positions in Albania through the years, and has steered national and international programs on diabetes in screening and prevention of complications, has also written guidelines on managing type 2 diabetes, moderated training programs for the medical as well as paramedical staff, and is a very well established author in peer reviewed journals and speaker at various national as well as international conferences of diabetes, just like this one. Interestingly, he is fluent in English, French, and Italian. And with this, you'll know why he is speaking on the next very, very important topic, which every patient probably wants to know: diabetes reversal. How far have we reached, and what is the future? With this, I present the poll question. Uh, what does the audience think? Is diabetes reversal a myth, a fact, or you don't really know? Please use your screens to give your votes. Are we done? Jimit? I don't have the results, but I'll welcome Dr. Florian Toti to uh, start with the presentation.
Thank you, doctor. Thank you, everybody. Thanks to Banshi for inviting me to participate in this wonderful congress. Everything now is going virtual, but I hope our discussion will be real. Do you see my presentation?
Yes.
Yes, sir.
Okay.
So we have the polling results. So 100% of the audience here thinks that it is a fact. So diabetes reversal is a fact as of today, is what the audience thinks. Dr. Florian, please go ahead.
Okay, thank you. So it's a good news.
Yeah.
So people have heard about diabetes reversal and how far we have reached. Sorry, do you see me? Because I don't see.
You make the slide presentation mode. Presentation.
Screen mode. Full screen.
Full screen.
Okay.
Mode. Full screen.
Okay.
Yeah, that's
Perfect.
right. That's right.
Okay, thank you. So just to give some figures about diabetes in general, according to the 2017 International Diabetes Federation statistics, there are approximately 425 million people with diabetes worldwide, and the number is increasing constantly all over the world. And the most regions that have increased the numbers are the African region with about sixfold from 1980 to 2014, and Southeast Asia region with more than fivefold for the same period of time. And there is a growing epidemic of type 2 diabetes in relation to obesity. Because, as we know, everything is a balance. Our organism needs it to be between food and physical activity. What is the main cause of obesity today? It's the sedentarity and bad habits of nutrition. That's why for 2.5 million years, we are going from the first man in the world, and in only 50 years, we are going to the obese people and sedentary obese people. And this is related with insulin resistance, which is a major defect in individuals with type 2 diabetes, reducing the biological response to insulin, and it is a strong predictor of type 2 diabetes, closely related with obesity, especially visceral obesity. How we can combat insulin resistance? With the loss of body fat, with physical activity, good blood glucose control, and food choice moderation, reducing carbohydrate intake. Changing our eating habits to a healthy eating, and increasing the time of physical activity.
जरा बघतो का रे ते काळे वायफायचं काय?
Type 2 diabetes has long been identified as an incurable chronic disease. The best outcome that has been expected is amelioration of diabetes symptoms or slowing its inevitable progression. Approximately 55% of type 2 diabetes patients will need insulin therapy within 10 years of diagnosis. But in the recent 2016 World Health Organization Global Report on Diabetes added a section on diabetes reversal and acknowledged that it can be achieved through weight loss and calorie restriction. Diabetes reversal is a term that has found its way into scientific articles, and the labels like remission have also been used. The criteria are still debated, but most agree that glycemic level and glycated hemoglobin under the diabetes threshold of 6.5% for an extended period for at least 12 months without the use of glycemic control medication would qualify as diabetes reversal. It could be partial for a glycated hemoglobin of less than 6.5 or complete if the glycated hemoglobin is less than below 5.7% without glycemic control medication for 1 year. We know that we have the remission from diabetes lowering the glucotoxicity, as in this Korean study where 92 patients with type 2 diabetes of longer diabetes duration go through a short period of insulin therapy, and after that 34% of the patients went into remission that lasted an average of 14 months. But we know also that in some cases we can have the reversal of type 1 diabetes, which gives hope to people with type 1 diabetes, even we have to accept that we are still far from the final result. There are a lot of studies, especially in the last years, showing some promising medication that can be used for the reversal of type 1 diabetes. But as you can see in this slide, the responder through the therapy are the most likely to have a longer remission of type 1 diabetes. But as I said, for the type 1 diabetes, we are still far. We have more studies and more hope with type 2 diabetes. In a large study by Kaiser Permanente with more than 122,000 adults in 2014, was found a diabetes remission rate of 0.23 with standard care, and a significant number of studies indicate that diabetes reversal is achievable using bariatric surgery, while other approaches such as low-calorie diet or carbohydrate restriction have also shown effectiveness in an increasing number of studies. In 2003, the Look Ahead trial randomized more than 5,000 overweight or obese patients with type 2 diabetes to an intervention group or just diabetes support and education. And you can see the differences between the two groups, with the group that has also the intervention losing more weight, especially in the first year, but even after that, the differences is quite statistics. And the difference, it was going for the all groups, for the people that didn't lose any weight, and for the people that lose more than 50% of the first initial weight. The direct study on 2018 in UK made a comparison between the control group and the intervention group, giving them a prepared meal for the whole period of the study. And at the beginning, the results were quite similar, and the primary outcomes was the weight loss of more than 50 kilos and improvement of glycated hemoglobin on no diabetes medication. On 1 year, the difference is quite big, and it was continuing in the second year. So the whole study was on 24 months. The remission was very much greater in the interventional group. And the remission at 24 months was more likely with greater weight loss from the baseline and greater weight loss continuing from the first to the second year. Remission was slightly more likely with older age and the gender male. But the remission did not vary with baseline BMI or duration of diabetes. 64% of the persons in the intervention group are in remission even after 24 months, and in total they have lost more than 10 kilos. And more the patients lose weight, more is the possible to continue to achieve the remission and to stay in the remission after the initial weight loss. So the conclusions were that type 2 diabetes is not necessarily a lifelong condition and is reversible by weight loss. 36% of the patients were in remission after 22 months and 70% in remission with more than 50 kilo loss. Maintaining weight loss is challenging. More than 10 kilo weight loss achieved by only 25% of interventional group. Ongoing support and relapse management limits weight regain. Early remission should be a primary management target for type 2 diabetes. Some secondary outcomes is improving in blood pressure, improving in lipids, especially in triglycerides, improving the quality of life, have less adverse effects. So that's why in 2019 ADA standards of care, it was included that low carbohydrate eating patterns, especially very low carbohydrate eating patterns, reduce glycated hemoglobin and the need for anti-hyperglycemic medication. These eating patterns does not appear to increase overall cardiovascular risk, but long-term studies with clinical event outcomes are needed. And you can see the bariatric surgery changes on glycated hemoglobin and in the weight changes with several interventional methods. 3 methods have been used to successfully reverse type 2 diabetes. Evidence suggests that bariatric surgery is the most effective method, but treatment cost and complete lifestyle modification after surgery remain challenges for wide adoption of this approach. While both the low carbohydrate diet and restrictive carbohydrate diet approaches are convincing also for reversing diabetes. There is a strong link between obesity and type 2 diabetes, with a 93-fold increased risk for men and 42-fold increased risk for women with the increase of BMI. And there are a lot of studies suggesting that weight loss from diet or metabolic surgery correlates with increased insulin sensitivity. That's why bariatric surgery is very important today. And most patients have complete resolution of type 2 diabetes, hypertension, sleep apnea, and dyslipidemia. There are several methods of surgical procedures, beginning with adjustable gastric band and continuing with more interventional methods. Adjustable gastric banding is laparoscopic, primary restrictive, and potentially reversible. It's the most used method and the easiest method to be used, so it's also the less expensive of all of them. But there are some poor long-term outcomes, reoperation rates of about 60%, 1/3 experience band erosions, and about half of these patients require band removal. That's why the Roux-en-Y gastric bypass is the gold standard. It's laparoscopic, it's both restrictive and malabsorptive. There is a good metabolic effect and the most common bariatric surgery in the United States. So this is the intervention, creating a pouch and creating a bypass, passing through or eliminating a great portion of stomach. There is a greater weight loss, increased resolution of diabetes, and improved quality of life with Roux-en-Y gastric bypassing, low complications rate and low rate complications, reoperation. Vertical sleeve gastrectomy, where there is 2/3 of stomach removed, ghrelin not produced, so there is a loss of appetite and is irreversible. As you can see, the resolution of type 2 diabetes, it's quite great. There is more than half of the cases, even in some cases 95% of diabetes resolved, so reversed, and with a big number of excess body weight going from 46 to more than 63% of the initial body weight. There is some changes in the hormones in the intestines due to this intervention that helps the continuous loss of weight and improvement on diabetes and metabolic control in general, especially ghrelin and incretin hormones. That's why surgery is accepted as an option in people with type 2 diabetes with a BMI of more than 35%. And there is some proposal to take in consideration to continue with a good nutrition with about 60 to 80 grams of protein per day and supplements of some vitamins and calcium to improve the malabsorptive related to this intervention. So is there a difference between surgical and medical weight loss? surgery is the most effective treatment for sustained weight loss. Surgery is the most effective treatment for diabetes, and it is difficult to lose more than 45 kilos without surgery. In general, with non-surgical intervention, the patients lose about 1/3 of their initial weight, being a good result, and the best result could be a less than 40% of the initial weight. But even with non-surgery, we can have some good results, sometimes comparable to surgery. And what is more important is that marked behavioral differences. So non-surgical work much harder in terms of diet and exercise. These are the results of some surgery intervention for people going down in their weight from 120 to less than 80, or from 120 to less than 90 in less than 5 months. But even with non-interventional method, we have some very good results, like this person with type 2 diabetes in low carbohydrate nutrition, which glycated hemoglobin goes down of less than 1.5%, and he is now off insulin, off blood pressure medicament, and lose in total about 70 pounds. So it is about, let's say, 30 kilos, and restored metabolic health. And this is the photo before and after, or during the low carbohydrate nutrition therapy. In summary, is long-standing type 2 diabetes reversible? Yes. Many studies have shown that there is the possibility of reversal, especially in people with short duration of diabetes. But now we have seen that in some cases, one person, even after 28 years following either hypocaloric diet or bariatric surgery, can have a reversal of type 2 diabetes. Is diabetes with normal BMI reversible? Yes. If you show me a person of normal BMI who has classical type 2 diabetes, I shall show you a relatively fatty liver. This is most evident in people of South Asian ethnicity, as it is in case in India and in some other countries. Will diabetes come back? No, provided weight is kept down below an individual's personal fat threshold to trigger type 2 diabetes. What is the best advice to prevent weight regain? Certainly, it must be a eucaloric diet with increased daily physical exercise. Also, possible benefits of specific food require to be formally tested. And we have to remember that this is a story just beginning. But now it is clear that type 2 diabetes is a simple condition of fat excess to which some people are more susceptible than others. Health-motivated people can reverse their type 2 diabetes completely and maintain long-term normoglycemia. So, this is from the magazine Time, the health issue Time, how not to end up here, and it say it's all about prevention. Why not reversal? This is something that I have prepared for this very interesting Congress, and I congratulate every one of you for inviting me. And I hope that I gave some answers to the questions and helped you to understand why the reversal of diabetes is not a myth, but now it's a fact. Thank you.
Thank you so much, Dr. Florian, for that fantastic presentation. I think we began with a very good baseline because of the audience believed that it's a fact, and then you
Yes.
ended up throwing more light on it. So, very well done. We'll just park the questions to the end of this session where we have some